Hello, everyone. Welcome to the podcast, the show where we highlight the success stories of business owners. I'm your host, Andre Wright, the owner of The Right Consult Digital Marketing. And today we have Dr. Kerith Powell of Dr. Chris Natural Remedies. Doctor, welcome, and how are you?
I'm great. Thank you for having me.
Perfect. It's a pleasure that you're here today, and I'm looking forward to a great conversation. First things first, tell us about your story.
As I like to describe it, chiropractic found me. I had an opportunity to meet with Dr. James Parker, the founder of Parker College of Chiropractic, as it was then called, in Dallas, Texas, for about 20 minutes. And it really changed my life. I knew that I wanted to work with my hands. I wanted to work with the innate intelligence of the body, or as some people refer to it as God. And I also knew that I wanted people to be happier when they left my office than when they came in, or in my space. I did not know what would fulfill that need, but Dr. Parker described chiropractic to me in those terms, and I made that decision right then and there. And I did everything necessary to become a chiropractor, and I've been practicing now for 20 years.
Nice. And it's doctor, it's amazing, talking to different professionals. You typically get that aha moment, that moment where it inspires you to move forward, and it's just good to hear your story and how it started. So I want you to tell our audience about what are your services? How do you, what do you offer to clients?
At Dr. Chris's Natural Remedies, what we offer is holistic care. The mission is to provide the people of Snellville and the surrounding areas with affordable, quality health care in a comfortable and pleasing environment. And we do everything that we can to meet that goal, and we do it on a consistent basis. We offer specifically chiropractic, which I am a chiropractor, and we can talk about that, what that means later. But we also include providers that do nutrition response testing, iridology. There are functional therapies such as cold laser, ultrasound, electrostimulation, cryotherapy, which is very cold treatment to specific areas. We offer supplementation and different things. All of that is combined to improve the individual's overall ability to handle stress. Stress is physical, It is mental, and it is chemical.
It's true. And doctor, because I've spoken to different, medical professionals and, chiropractors, and they have specific techniques, of how they do things. And I know that you really focus on the natural remedies. Talk about your specific technique. How do you treat your patients?
Yes, each individual is different and requires different things at different times. So we have specialists in the office for that, for all of those areas. My particular interest is in analyzing the patient for subluxation, vertebral subluxation. And that comes in a complex in most times, where there is movement issues, there's nerve transmission issues, there's cellular effects, and then degenerative processes occur and become accelerated. I identify them and correct the interference. And I'm sure that would need some explanation, but that is the goal of chiropractic, and that is what I do. Now, the method in which I do it is different for each patient as well, because some people are, let's say, I wouldn't treat a newborn the same way that I would treat a 13 or 14-year-old athlete, and the same way I wouldn't treat an 80 or 90-year-old grandmother who wants to tend her garden. But with the techniques that I offer, my primary analysis is something called Thompson. I use what chiropractors would recognize as full spine or diversified. I incorporate the activator protocol and instrumentation. And then there are some other devices that I use, like the arthrostem and the vibrocursor, that assist me in improve patient outcomes.
I want you to walk our audience through the process. What's the first thing that you would do? Is there a specific process that you do to diagnose, or tell us about that?
Well, that is a great question, because most of our new patients are coming based on referrals, so they have some idea of what to expect. Okay. But we do get a significant number of people that don't know what it is that they're getting into when they call us, and want to know more or how to get started. And because of all of the specialties that we offer, our staff, which is absolutely amazing and very able to communicate with the patient what their needs are, can provide them with the best provider for their situation at that time. Then we, depending on who the provider is, if they saw me, for example, I would take a complete history. All of our doctors do. We do a review of systems. All of us do. And then that's where it starts to kind of branch off. So I'll do a neurological, an orthopedic, and a chiropractic examination on the patient, and determine whether or not imaging is necessary or what are the next steps we can begin and what that care plan looks like. If it's one of the other providers, they may go through stressors that includes chemical stressors, food allergies, and then they do a system by system organ scan. They also evaluate the patient for how they have healed from old traumas, whether they be physical, chemical, or mental, and put all of that into an assessment and create their own care plan for them. If they see someone who is managing their functional health, say an athlete, young athlete that may, or older athlete that may have tennis elbow or some other injury, sprain, strain, that evaluation is done based on those regions, and the treatment plan is then created to correct the problem that the patient came in for. So we have a wide range, and we treat everything well, I do not want to be presumptuous. We don't necessarily treat everything, but we are able to assist the individual in coping with everything. So it's a whole body approach.
Fantastic. And doctor, there's this big thing now about telehealth. I've spoken to many doctors, and they have a strong focus on that. So do you offer telehealth, and how is that in your practice?
Well, the distance health portion is we make it available to our clients, and we always have prior to the recent situation that we find ourselves in, because there are people that are clients of ours that live local that may travel. One, they share that information with their people that they meet. Those people call us. We're able to do some services that way, long distance. The absolute best approach is in person. And however, we do make it available to people from a distance standpoint.
Awesome. I know you touched on this situation, but we know you're referring to the greatest pandemic of all time. How has this impacted your practice?
Well, back in March, when it first was announced that this was a thing, and classrooms were frozen in time, and people decided that other people were threatening them just based on their existence, I sent a letter to all of my patients, and I explained to them that two things. One, chiropractic has been proven to be effective. Well, let's just say that the outcomes for patients of chiropractic care versus allopathic care in the Spanish influenza pandemic were better. So that they should feel very confident in the fact that their bodies are prepared to handle these stressors, including this new one. I also mentioned to them that they should be prepared to be exposed because everyone is at risk of exposure, and we cannot sanitize our way out of this condition. And I have a whole nother subject that I can talk about as far as it goes with sanitation and the superbugs that it creates. But we cannot do that for this or any other virus. And the more that we try is the stronger they become. So the best defense is to work on your body, the host. Make the host an unlikely target for the virus, thereby improving your outcome measures. And that's basically how chiropractic works. It helps the body to fully express itself. And once we do that, there's no doctor on the planet that can touch a button or push a thing or inject you with anything that's going to harden you. That's not it. It's your own innate intelligence that does that. And that is given to us at birth, at conception.
And I'm glad you mentioned that because it's always important to strengthen our immune system, against these viruses or any ailment. But I wanted to talk specifically, how does chiropractic care strengthen or boost your immune system?
Now, I won't get scientific on the studies and everything that have indicated that chiropractic can help lower blood pressure, boost immune system, all of these other things. All I'm going to say about that question is that the nervous system is the first system that develops or is at least visible in a fetus, and it becomes the central nervous system, which is the brain and the spinal cord. The spinal cord is just the tail of the brain, an extension of it, and that it also includes the branches and tributaries of the spinal cord that go out into the rest of the body. Your central nervous system is connected to every organ, tissue, cell in your body, either directly like a plug in a wall or indirectly like a signaler on a ship to the harbor master. So you have your nervous system monitors, regulates, controls all of these functions. And if it is not in its optimal state, none of the other systems can be in their optimal states. So it doesn't matter what you take or what you do. If your nervous system isn't functioning at its best, with the least amount of interference, your body will not be able to even do the things that you think it will do based on the stuff that you take. So that being said, your immune system is a part of that system. I'd also like to mention that the immune system is mostly resides in our gut, and that people should consider gut health. And that may include a probiotic or some other thing that they want to incorporate. But to boost your immune system, I would start there in the gut, and of course, make sure that my nervous system was functioning fully.
And doctor, we have a tendency to only see a chiropractor when we're feeling pain.
Right.
Why is it important to, even when nothing is there, to come and see you?
Yeah, so that is, and I educate everyone that comes through the office in this, because most of the people that come, they're coming for a condition. I mean, otherwise they really wouldn't come, whatever it is. I mean, if they heard about me from someone who I helped with headaches, they're probably going to be a headache patient, right? Because people with headaches talk to people with headaches about their headaches, right? And that's not unusual, but there are so many other things. I've had people leave the office saying that their vision was better and their hearing was better and they could breathe better and that their sinuses were cleared, and that the brain fog was lifted. And all of those things occurred during the visit. And the chiropractor, being not the healer per se, but the one that identifies the interference and removes it, can stand back and really enjoy some of these, what seem to be miracles happening on a regular basis.
our listeners they may be listening right now, and they will be thinking, there are a lot of chiropractors out there. What's different with Dr. Kerith Powell? If you could say what separates you from the another chiropractor?
Well, I think that everyone should see a chiropractor. Every single person. We don't have enough chiropractors. And I think that there is a chiropractor for everyone. I don't know that I'm the right chiropractor for everyone. I can tell you that I will do my best, and I will offer you the best solution that I can produce for you based on my experience. And I also recognize that there are other chiropractors out there that have specialties that you, as the patient coming in, might need. And I have no problem referring you that, because the goal is to have the healthy community. A healthy community is good for everybody. It reduces the prison rates. It decreases road rage. It helps children become as independent and productive citizens to our society as possible. So it's in our best interest to do that. And it is also in mine. And that's what I do for patients when they come in. So why they should see me is because I personally am a chiropractor, and the office that I work in offers solutions for a wide range of things, all of the stresses that affect us in life.
Fantastic. What's the biggest misconception of chiropractic here?
Yeah, I do not pay attention to that myself personally. I know that when I started out, it was difficult to get people to come and see me that had to pay out of pocket. But that has changed so much over the 20 years that I've been in practice, and people understand now that the healthcare system, healthcare one word system, is not really healthcare. It's sick care. I do healthcare two words, health care. And that's because me and my office, we separate ourselves from the healthcare system in that we don't ask people what is their sickness. Okay. What we want to do is improve their health. The more that health is improved, the less sickness is. And people that are 80 and 90 can go out into the garden and do everything that they want to do and not get help. They can stay in their homes. Okay. Kids that are aspiring athletes, they can perform better. It's easier for them to handle the stresses of the rigorous athletic program and the academic program. There are so many advantages to this.
One thing is that I hear all the time is that, you don't want to go to a chiropractor because you got to wait until something is really bad, because if you go early, you're gonna be hooked. You're gonna be hooked, and I'm gonna have to pay you every single month.
There isn't any chiropractor that I know that requires somebody to see them. It is optional, right? However, most people, once they understand it, they start to experience it, they understand how valuable it is, and they want more of it. We don't have any contracts in my office. We don't do any kind of prepayment plans or stuff like that. It's all fee for service on the day of the visit. So, and people make their appointments way ahead of time. I have people that only see me every 6 weeks, every 8 weeks, and they come, and that's their checkup, regular checkup, because they've gotten themselves to that point. So, getting hooked, I don't think is a bad thing. You're not going to ditch your dentist, right? You're going to keep your dentist. You want to keep your chiropractor just as much as you want to keep your dentist.
Of course. Oh, fantastic. And I know you touched on a little bit of your payment system, your fee base, but what about insurance? Do you take all types of insurance?
We don't process any third-party payers in my office. So anybody who has insurance that has benefits under it will have to handle that with their insurance provider themselves. And the office will provide whatever documents we need to provide for them in order to do that. But we don't get involved in that. That is a relationship between the insurance company and the patient. I want to have a relationship strictly with the patient, and that's how we do it.
All right, fantastic. And doctor, let's look in the future here. Tell me, where do you see chiropractic care in the next 10 years? Where do you see this going in relation to our healthcare system?
Yeah. So it's been my vision ever since I found out about chiropractic. This is essentially what I've thought. I mean, it's the most conservative type of care that you can get. And, we have a poster in the office that it has 3 pictures and 3 words. And at the top, it says first. Underneath it is hands chiropractic. Then the next word is second. And the picture is handful of medicine or pills. And then the next word is third. And then it's a surgeon's hand with a scalpel. So we think that chiropractic is the most conservative care. Yes, there will be a time when people may need some sort of supplementation, either nutritionally or over the counter or prescription medication. We're not anti-medicine, okay? But what we're saying is that why don't you save your liver, because it's a lot of these medications are toxic to the liver, for when you really need it. You can go without the medication. If you could go without the medication for a little bit longer, then you're actually extending the period of time that you have fully functioning organs to help you filter all of the toxic chemicals that you may need to put into your body, if that is the case. But we have so many people that take no medication, either over the counter or prescription, just through the nutritional supplementation and chiropractic care, are able to live full lives. And that's our goal, is to have people do what they want to do with their bodies for as long as they want to do it. What's the point in just getting to 60 or 70, 60, whatever the age is now, and then not being able to enjoy all the things that you wanted to when you were younger. So that's where we come down on the whole thing.
And that's great. That's a great perspective there, doctor. I'm a strong believer in natural remedies too. So I completely agree with your perspective and your approach as a practice, your holistic approach, because I strongly believe in that. As we discussed earlier, I mean, you look at the whole health of the individual, not just say one specific issue, and that's great. And doctor, I can't believe that we're almost out of time, but I want to talk about something that I know is close to your heart, your philanthropic work in Haiti. I want us to talk to our audience about that. What do you do in Haiti, and what's happening there?
Wow. So recently I returned from Haiti on what is my first of, I know will not be the last trip to Haiti. My focus there is in the town of Guatemala, to provide mothers with a clean place to deliver their children. And when I say that, it's hard for someone in a first or second world country to really understand. And even a third world countries, some of them have better conditions than these people that I met. So the need is there. Highest maternal death rate during pregnancy in the Western Hemisphere is in this region. And so part of the problem there is that they don't have access to clean water, clean space. And so we're going to provide that. But underneath all of that, by providing that space for them, is actually helping the fetus to develop better, because the mother will be less stressed about the pregnancy. So many studies have shown that that is the case. And so what we're going to do is affect the next generation of children in that area, giving them a head start by simply providing their mothers with a safe space to deliver, and they can stay for a little while afterwards. So that's my mission down there. I've gotten a lot of help from my patients. I've gotten a lot of help from chiropractors around, and students even. I've got lay people that are retired nurses, dental hygienists, asking about how to help. I've got doulas in the States that want to come down on the next trip and assist. So it's going to be a fantastic opportunity for us to give back to a community that really, really needs it, and be human, be a part of this world, to try to help someone somewhere that we don't know and may never ever know us have a better life.
Yeah, that's great, doctor, and thank you so much for that. We should always help, whenever and wherever we can, and that's really good that you're helping out Haiti. So I want to tell our audience, how can we, if we want to help, where can we go and help, and talk to us about your how can we reach you?
I'm available through the internet at drchris'snaturalremedies.com. You can find out anything you need to on that site about me, how to contact me, make an appointment, all of those things. It's a pretty decent site. That's DRCHRIS naturalremedies.com. You could also email me at info at the same address, or you could call the office if you like that. The number is 770-979-5125, excuse me.
All right, doctor. Thank you so much for sitting in today. I really enjoyed the conversation and what you have to offer, and I think our audience definitely enjoyed too. And so until we talk again, thanks again for being on the show.
Thank you so much for having me. You have a wonderful day.